Okay, let's get started. Good morning, everyone. My name is Joe Eberstein. I'm with the Center for Community Research. And welcome to today's Countywide Media Public Messaging Training, which is an overview of SAMHSA Prevention Technology Transfer Center Social Media Toolkits and the Talk They Hear You campaign from SAMHSA. We're so delighted to have Clarissa Lam Yuen, Alyssa O'Hare, and Craig PoVey. Clarissa is the Training and Technical Assistance Coordinator for SAMHSA Prevention Technology Transfer Center Region 9, very diverse region. And Craig PoVey is the Project Director for Talk They Hear You campaign. Alyssa, one of my favorite people, just got 5 years more funding for the Prevention Technology Transfer Center, is the Director for the Prevention Technology Transfer Center Region 9. A little bit about Craig. We're going to bounce around a little because I got more of an extensive background on him. Was the state of Utah prevention director for the past 20 years. During his prevention tenure, he was trained in multiple prevention programs, including Botfin Life Skills, Strengthening Families Program, All Stars, and Communities That Care. He also volunteered on community prevention coalitions for 10 years. Today's workshop will go from 10 a.m. to 11 a.m. The training is being recorded and will be posted on the CWMA YouTube page. We'll start off with presentations, and the remaining time will be used for dialogue and Q&A. So on that note, I want to hand it off to Clarissa. I believe you're going to go first. All right. Thank you so much, Clarissa, for doing this. It's all
Thank
you.
you, Joe.
Okay.
Thank you, Joe. Hello, everyone. Thanks for sharing your time with us today. I'm going to provide a really brief overview of the Pacific Southwest Prevention Technology Transfer Center, or PTTC. Again, my name's Clarissa Lam Yuen. I use she and her pronouns, and I'm a senior project coordinator at CASAT. Here's our disclaimer. You might have seen it before, noting that this presentation is supported by SAMHSA, our funder. However, the contents are those of me, the author, and others on our team, but do not necessarily represent the views, policies, or positions of SAMHSA. So as we get started, I'd like to gauge who's in the room. Can you just type in the chat just type in one if yes, you have participated, you're familiar with the PTTC, you have come to our events. Type a 1 if that's you in the chat. Type 2 in the chat if you're not familiar with the PTTC. Just want to gauge who's in the room. Seeing twos. I like the variety, actually. All right, keep typing. Thanks so much, everyone. 1.2. Oh, okay. I'm not sure what the 1.2 is, but so maybe you've heard a little and then haven't participated. Maybe that's what a 1.2 is. Well, thanks everyone for sharing that with me. Lets me know who's in the room and gauge how deep a dive I need to go into. Gives us a starting point. So just overall, the Pacific Southwest PTTC is part of a national network, and we offer a variety of trainings that you can access for free. This is a map of our Pacific Southwest PTTC region, or HHS Region 9, and it includes California, y'all, so it's great to be here with you all. Includes our other states, Nevada, Arizona, Hawaii, and then our Pacific jurisdictions as well, American Samoa, Commonwealth of the Northern Mariana Islands, the Federated States of Micronesia, Guam, Republic of the Marshall Islands, and then Republic of Palau. As you can tell, we have a large and diverse region, and your PTTC team is, your Pacific Southwest PTTC team is located at CASAT at the School of Public Health at the University of Nevada, Reno. So to access our services, if you haven't done so already, I suggest you join our mailing list. And Alyssa's going to drop that mailing list link in the chat. So if you have not already done so, want to participate, see our latest resources, and like I said, we're part of a national network. So on our website, we keep folks up to date with what we have planned free trainings, again, free resources to access. So you can see what's coming up. Again, join our mailing list. That's the easiest way. And then, or visit our website. Both are available to you. So as Joe mentioned, we're thrilled as we're entering a new cycle with the PTTC network, and we're honored to continue to serve as your regional PTTC. This renewal represents both continuity in our commitment to supporting the prevention workforce and an opportunity to enhance our services based on emerging needs. In the coming slides, we're going to share our goals and planned activities for this new cycle, and we're really looking forward to incorporating insights from our regional needs assessment survey. It'll help us tailor based on specific needs and challenges in our region. So we can walk through what we have planned so far. Our first goal is pretty straightforward. It's to increase prevention science knowledge and skills to effectively implement substance misuse prevention programs, practices, and policies, and to increase health equity. Some of the ways we'll do this, some examples that we have include quarterly emerging topics webinars that we'll provide. We'll also have some enhanced prevention learning series, or EPLS, and these are multi-session virtual learning series. We'll also offer curricula-based trainings, such as the SPIF Application for Prevention Success Training, or the SAPST, along with curricula-based training of trainers. So I want to emphasize that we offer the TOTs so that if states want to have their own cadre of trainers, they can. But we have to have a starting place, so we do offer at least one basic of the curricula-based trainings to build that base. We're going to also offer micro academies, and in year one we're starting with alcohol policy. However, cannabis policy is likely to be included in the future. And our micro academies are intended for intermediate or advanced members of our prevention folks. There will be an application to participate in our micro academies. We just want to make sure that the right folks are ready to fully participate. And it's really an opportunity to help community organizations, do that policy work. Like, how do we do this work in the right way? And how do we do it in the right way and not risk losing our funding, et cetera? So it's a really great opportunity, and we're looking forward to providing that. Another thing I'd like to note, our specialty area of focus will be on data-informed prevention. So we'll provide training and technical assistance on data-informed prevention, everything from using needs assessment data, collecting it, using it, how to use data throughout the life cycle of your prevention work. And, so think of data as the compass that guides your prevention journey. It helps us identify where services are most needed, shows if and how our strategies are working, and helps you tell the story of your prevention efforts to key partners and communities. So we're excited about our specialty area. Our second goal, to serve as a prevention resource by developing, testing, and disseminating learning resources, tools, and products for prevention professionals, key stakeholders and partners, and the broader behavioral health workforce. So we understand that prevention professionals need accessible and practical tools and resources to support their daily work. That's why we're committed to developing new resources and ensuring that you can access the wealth of existing materials that's out there. We'll be creating and sharing a diverse range of resources tailored to regional needs, from bite-sized micro trainings that fit into the busiest of schedules to tailored guidance documents and fact sheets, tools that really provide deep dives into specific prevention topics. Some of the potential topics that have come up include improving the selection, implementation, and evaluation of prevention services, improving the use of data, and advancing health equity, and then looking at prevention across the lifespan. We'll also curate and share high quality resources developed by other training and technical assistance centers and other partners. We'll also provide a clearinghouse of prevention resources. So we're helping to ensure that our best practices and the innovative approaches are readily available to strengthen prevention work across our region. Our next goal is to advance and sustain a prevention workforce that truly reflects the diverse communities that we serve. This means not only providing the high quality training and technical assistance, but actively working to increase entry into the prevention field and professionalization of the prevention field. So with that in mind, I'm excited to share our involvement in the Building Our Leadership and Diversity or BOLD Prevention Fellowship. It's a national initiative, and the purpose is to increase the number of prevention professionals from underrepresented populations. In year one, our focus is on Black and African American prevention professionals. And 3 of the main components of this fellowship, the first is that fellows will gain a hands-on experience through mentorship at a state prevention agency, where they'll be able to apply prevention concepts in real-world settings. Second, they'll receive guidance from an experienced prevention scientist as part of a cohort of BOLD fellows, creating a supportive, really nice supportive learning community. And finally, fellows will have access to both virtual and in-person professional development opportunities, including support toward achieving their prevention specialist certification. So really by investing in these emerging leaders, we're strengthening the foundation of prevention work across our region and ensuring that our prevention strategies are more effective and culturally responsive for the communities that we serve. And finally, our 4th goal is to strengthen communication and collaboration with our region. Part of the strategy is through our Regional Prevention Advisory Council that Mr. Joe Eberstein has been an active member of, so shout out to Joe. We'll also have state advisory groups that only meet once a year. And the function of the advisory council is to advise us as the regional Pttc. Like, what are the types of services that we really should focus on and provide? I'll mention it again. We do an annual needs assessment survey. Well, we did it this year, but perhaps later on for other opportunities, other years, maybe we might adjust to listening sessions, perhaps. So as I mentioned, we have the state advisory groups, and they will look at state-specific needs assessment results and share state-specific solutions, ideas with us. Then the advisory group will come together and share what other training and technical assistance is already happening in their state, so that we can look at the results in the context of what is already happening and or scale up versus duplicating services and efforts. I'll note here that due to the increases in travel costs all around, our meetings are virtual. However, we do invite you. We will have opportunities for informal meetups when some of our staff, our team is at like CADCA or NPN or other in-person types of events nationally. So if you will be at one of these, please don't hesitate to say hello to our team. Or reach out. Let us know if you'd like to do one of these informal meetups. We'd love to meet with you. Here are some of our upcoming training opportunities. Again, they're all free. Since our region includes multiple time zones, all of these events listed here start at 3 p.m. Pacific time. The first is this afternoon, actually. It's our first webinar. We're excited to bring it to you. It's Weaving Wisdom with Innovation, Timeless Indigenous Strategies for Contemporary Substance Use Disorder Prevention. And the session will highlight how blending traditional and modern practices creates effective community-based prevention models. So really, really excited. If you didn't know about this, click on the link in the chat. Come and join us. Join us for the webinar. It's at 3 p.m. Other opportunities include a Prevention Basics Enhanced Prevention Learning Series that'll start on January 7 and run on Tuesdays through March 4th. Everything prevention basics. If you want just the foundations or perhaps a refresher if it's been a while, join us for the prevention basics. And then we do have 2 or 3 actually webinars coming up that will be in collaboration with the Strategic Prevention Technical Assistance Center. We'll be co-hosting this. First is collaborating with Educational Leadership for Substance Misuse Prevention. It's on December 5th, and there will be a couple more links in the chat for you to learn more and register. And the last one is the 2-part webinar series on evaluation basics. So again, they're all free. Join us. They'll be wonderful. So I can't say more than that. I'm looking at the time, so I'll just keep going. But the links are, I'll just highlight the links are ready and available for you in the chat if you'd like to learn more and register. As I mentioned, we do have our annual needs assessment survey that just closed on November 15. We're currently in the process of analyzing the results, and the data will really help us tailor our training and technical assistance to address the unique challenges and opportunities in our region. So we are taking a data-informed approach to our own work and practicing what we teach. While we wait, we're excited about these insights, to fine-tune our service delivery again. So whether it's identifying emerging training priorities, understanding technical assistance preferences, or recognizing gaps in current prevention resources, your feedback is so valuable and really does directly shape our programming. How to connect with us. I think Alyssa already added in there our website and the link how to connect with us. Join our mailing list again. Our monthly e-blast will keep you up to date on everything happening in our prevention community. I encourage you to check out our website. It serves as a comprehensive resource hub for prevention professionals. It has our archived webinars, toolkits, fact sheets, and other valuable materials. So feel free to reach out to me directly with questions about our services or if you need technical assistance. Thank you for your time again today, and don't forget to sign our mailing list. Later on, I'll add a link, or maybe it's already there, to a list of resources actually specific to social media and some of other resources we already have developed, we and other partners. So I'll hand things back to Joe.
Thank you so much, Clarissa, and thank you for putting your contact information in there. Did an excellent job. Alyssa, I don't know if you have anything that you wanted to add possibly. And then Clarissa, if you see questions pertaining to you in the chat, feel free to answer them. Alyssa?
I think Clarissa did a great overview of our work plan, which is still a work in progress because we are barely entering into our new 5-year cycle, and we do take a data-informed approach. So we just closed our needs assessment survey, and we've had our first advisory council meeting. And so we're moving forward with now filling in some blanks and really kind of tailoring it to what our region needs and wants. And we will continue to take feedback formally and informally throughout the 5-year cycle. So please do reach out if you have questions, or if there's a specific interest you have, we can see what we can make work with that. So thank you all for letting us have this time. And it's great to have an opportunity to share, especially since initially a few of you indicated you weren't yet familiar with us. So please do join our mailing list and take advantage of our trainings and resources. So, and thank you, Joe, for the invitation.
One of the reasons I like partnering with the Pttc is because we really take the field of prevention seriously. And I know Alyssa and Clarissa are champions of growing this field. Alyssa, can you talk a little bit about how we're trying to grow the field and get people certified and why it's so important?
Yes. So there's a few strategies that we implemented during our first cycle, and that some of them we're continuing into this next cycle. One of them is we want to make sure people are entering in the field with at least some sort of foundation of what prevention is, especially as it relates to substance misuse prevention. What are risk and protective factors? Why does that matter when you're selecting your interventions? Why do we not just pick off a list? So we've created some curriculum infusion packages that we are attempting to get into some undergraduate classes, community colleges, universities. They're very short modules intentionally so that they can easily fit into an existing college course without a lot of rework on behalf of the instructor. So we are working to kind of disseminate those and increase the uptake of that. We also have our Bold Fellowship program. We are opting into a national fellowship program, as Clarissa described, and each year we'll be focusing on increasing the number of people who represent underserved populations so that we have a more diverse workforce too. So it's attempting to both increase the field, but also increase the diversity of the field, because we are simply stronger when we are more diverse. Another thing we are doing is working on a portfolio of resources that are really intended for the people who would be doing the hiring of the prevention workforce. So they have a sense of what to look for. Maybe they should consider encouraging certification. Maybe there's some ways they can incentivize this. I just learned a few days ago that Hawaii has a program where you can get your student loans, part of your student loans paid for if you have a prevention specialist certification. So I'm hoping that they will do a presentation for our region, or at a bare minimum, talk to the other certification boards in our region. We are working closely with the certification boards to make sure all of our trainings are of sufficient quality and standard that they'll accept our certificates. And we've never had an instance with having certificates accepted towards certification. So a big part of it is getting those continuing education hours, which we can provide. They are accepted by all of the boards in our region, and we keep in close communication with them to make sure that happens. But really, certification to me is really important because it ensures that the workforce is prepared to work with a sufficient level of competence, with ethical principles, following the science. But in our region, I always say following the science, but also following cultural practice and approaching it with cultural humility, and knowing that what works for one population does not work for another, and be very open to acknowledging what works for different communities at all levels, really. So I probably said more than you wanted me to, but
No, I think that was great news, and really from Hawaii, that's excellent news.
pretty
To
cool.
incentivize getting certified is definitely something that I am all for. Because again, we are traditionally underpaid in this, prevention industry. And it's about time that, there's something that kind of levels out the playing field for people to want to get certified. So Alyssa, thank you so much. You've been one of the best partners we've had. I can't believe it's been over 5 years already. But thank you so much. And again, Clarissa, thank you. I'm excited to learn now from Craig about the Talk They Hear You campaign with SAMSHA. Craig, are you ready to rock and roll here?
I hope so.
Okay.
I know when I tried to share before, it just didn't quite work. So let's see how this goes.
Okay.
Share the right thing that time.
You should see like a green button that says share.
Yeah, I got that. And then I picked my screen.
Is it up? Okay, there we go. We're seeing some action here. There's
your,
did you, I see your PowerPoint is open. Is the red PowerPoint on the bottom?
Let me try to, I don't know why it's doing that, because the screen that I'm sharing is my PowerPoint. So I don't know why it keeps going to.
Sarah, do you have any tips that you can share?
If we have a copy of your slides, I can share them for you.
You want to
when you go to share your screen, does it give you?
It gives me
There
like
you
three
go.
options.
There it is.
That's it.
Get it?
Perfect.
All right. so good. Thanks. Yeah, so I'll have my contact information. I'll throw that in the box or in the chat, but it's also on my last slide, which certainly will be sharing my slide deck. Want you to know that I got some things to cover today, and as usual, before I know it, I had like a 8-hour course all hammered out for you all, and so then this morning had to go through and try to make this reasonable. But let me just say that I landed in Talk to Hear You as a project director after a really quite the long journey. And I want to share that with some of that with you, because it really goes into the context about what best practices in the media and what we're trying to do with Talk to Hear You are as far as it goes with prevention. Alyssa, you might recognize some of this. I was trained by the best. I was in the treatment field for a dozen years and ended up in prevention. And it was right at a time when the federal government was pushing out evidence-based programs. The CAPT, and specifically West CAPT, was training us on what evidence-based prevention was and what we needed to do with it. Shortly thereafter, or that was a SIG and the SIGA grant. And then shortly thereafter, the feds came out with the strategic prevention framework, which hopefully is very familiar to you all. But as we were looking at the evidence-based programs, there's also another push for environmental strategies instead of the programs. And if you're interested in learning those and how they pertain to some of the media things that I'll be talking about, South Carolina, Michelle Nienhuis is the prevention director there, does a really nice job of explaining how the dollars that she's used to impact and how they wind that in with some of the things I'll be talking about. Now, what I think is important is this interagency coordinating committee on the prevention of underage drinking. So right about that time when late 90s and early 2000s, when we started kind of learning more about how alcohol was affecting the teen brain, et cetera, this interagency committee pulled together teams from the states to go to Washington, D.C. to hammer out plans on what to do with underage drinking. And lo and behold, this probably isn't surprising to anybody, but everybody gets super excited about media campaigns. And so, I went around the state of Utah where I was working and asked everybody, oh, okay, we know about this underage drinking, that it's different than what we thought about even 5 years ago, how it impacts a brain and, the addiction, all those kinds of things that we were learning at that time. We got to do a media campaign, was the first thing out of everybody's mouths. And, they cost a lot of money. We knew that no one community could ever do that. And so out of that interagency, or the ICPUD, worst name in the world, I think, but they, coming from off the hills of that, our state group pulled together and found some state dollars to do a media campaign for the entire state. Now, what's interesting is I was at the table as the person that knew prevention science. And so when they started talking about media campaigns, they said, well, we want to be effective. Yeah, we want to be effective. So how do we do that with a media campaign? And I said, well, it's never been done. There's no hard evidence to show that using a media campaign is going to drive the numbers down that we're hoping for. And still to this day, I would say that that's true. There's some efforts that have shown some marginal effects, but overall, if you're just going to rely on a media campaign to be effective or to reduce the rates of underage drinking or other substances, I think you're going to be disappointed. Now, if somebody's got something going and they're evaluating that and I'm proven wrong, that's fantastic. But what we did is we took that information of a media campaign, or I shouldn't say information, the motivation and the energy that we had about a media campaign, and started to really think through, well, what can we do with this? We learned from those early federal grants, but all of a sudden we had a bunch of money that we'd never had before in the system. And we thought that we had arrived. It's like, we're going to be able to purchase evidence-based programs throughout the entire state. we're gonna have all these parenting classes, we're gonna do all these different things. And we're gonna get finally what we've always wanted to do. Well, all of a sudden we ended up with parenting classes with 1 or 2 people. We ended up with schools that really didn't want to participate in prevention programming, run into all these different problems like that. And really it came down to why, why should we be addressing these things? It's not a problem in our area. And in fact, speaking of underage drinking, we heard this multiple times, is that why don't you do something that's important, like continue to address tobacco or cocaine or, a list of other drugs that were popular at that time. And so it's like, well, we got to teach them. They need to understand the harms so that they know why they need to step up. They need to understand what they can do about it. And they need to understand that there's much more to prevention than a media campaign. So we came up with this whole idea of we need to mobilize and organize communities. About that same time, Utah was one of like 9 states that were participating in a huge research project on how to increase evidence-based prevention in communities. And that was called the Community Youth Development Study, which the foundational piece of that is the communities that care, which guess what? It mobilizes and organizes community prevention efforts. So I'm going to say that the CTC, the Communities That Care, is owned by SAMSHA now. It's passed hands at least twice, but SAMSHA does own that program. There's a lot to it. It's very sophisticated, requires a lot of coaching, which the University of Washington, where that program was hatched, still has a social development research group that provides coaching for anybody that would like to do that. Now, we were pushing for that. I was proven wrong. I didn't think it was going to make much of a difference in our state and the communities that were participating in that study. And I was proven wrong. Guess what? What I thought was a brilliant idea, and my colleagues, what we thought would really work in prevention, didn't hold up to the science that CTC was pushing into those communities. They had far better outcomes than we did. And so we decided to adopt that and move forward with it. The issue was, how do you talk key leaders in your community to come to a meeting? How do you talk to schools and get them on board? How do you get parents to pay attention to these things? And that's where I have found that the media campaigns, and I'm going to present this today. I think that the best effect of a media campaign is the mobilization piece. This says CLP on here, and that's because I spoke about this for quite some time. Finally had a graphic artist help me. But basically what this is, the communities that care are in the middle of this. And then I put the strategic prevention framework, the 5 steps of that, including it as well. That's where a lot of the communities are. And then you'll see that blue kind of, I don't know what color that is, real pale blue spirograph kind of thing that bounces in and out of there. And that's where media campaigns, that's where other initiatives a coalition might want to jump on board or be motivated to help with, that maybe doesn't have evidence backing it. But I've learned that in order to mobilize communities, you got to start where they are, and then you bring them in. And that's what that's supposed to reflect there, is this pulling the strings back in. So going back now to, talk to hear you, and how that all ties into what I'm getting at here is that back after that ICPUD meeting, so in the early 2000s, I was involved in some work groups, and later the Center of Substance Abuse Prevention National Advisory Council. And we had opportunities to help form what Congress decided that they needed to do. Guess what it was? A media campaign. And so it's like, what lessons have we learned? Well, we've learned that number one, media campaigns that are directed directly towards youth have essentially no impact on moving the needle or the outcomes, the use outcomes. So the idea is to address a media campaign towards parents or adults to help them better understand what they can be doing and why they should be doing these things in order to drive those rates down. So being at the federal level and also working on that at the state was really interesting. Now, I worked 30 years for the state of Utah working on this campaign, the whole time talking to the feds of drive it towards the adults, use it as a mobilizing and organizing effort. And then once you get people mobilized and interested in what you're doing, now you can have this grassroots effort that's going to be able to be in a better position to address the specific needs and utilize the specific strengths of those local communities. So what I've brought to this whole project now, and I can only guess that that's why I was recruited and asked to, apply for this position, is because of all those years of always trying to go back to, we know what the prevention science is. We know that there's a lot of politicians and leaders and even population in general that think that media campaigns are the best thing to be doing, but we can't just rest on that very piece of a media campaign. So that's the whole thing of Talk They Hear You, is this idea of where we're taking it is to make sure that we're being driven by the science and making sure that the communities across the nation, we've got like over 3,000 partners now across the nation that have been licensed to use Talk They Hear You in their communities, and then use that to mobilize their efforts. Now, I'm hoping that this is going to work. Did that slide over? Are you seeing the Talk They Hear You?
No.
No.
Ah, shoot. Okay. Well, okay. I don't know how bad I want to mess around with this.
If you want to put a link in the chat, you could.
Okay, perfect.
Instead of messing up, you're on a good roll here, so.
Yeah, thanks. Okay, so the Talk They Hear You campaign, we have over about 350 products that have been developed over the past 10 years. I've been involved in less than a year, by the way. Now we're doing a whole refresh on the Talk They Hear You, all the products, making sure that the data's updated and all the graphics and everything are matching of what they need. But what you'll see through the Talk They Hear You is not only a bunch of PSAs and posters, and I mean, there's even a podcast that we're developing with some well-known prevention researchers and practitioners, and maybe as important for our cause is with parents. But you're going to see how that all of those products are able to be adapted to the local community. So if you're in a community, you want to do a media campaign, you could look at this website that I posted in there and see the catalog of products. And if there's something in there that you want to use, all these are free. All you got to do is ask us for a license. We'll license you. And then what's even better, I think, is that you can say, you know what, we really like this poster. We want, and our business community is on board. We know that we could get them to start hanging these posters up or whatever, but it doesn't look like us. So what we do is we work with the individual communities and say, okay, well, let us help you make it look like you, so to speak. So you'll start looking around in our products, and you'll find that there's all kinds of opportunities to be able to do that. So whether it's activities that are big in your community, there's some of the pictures that have been used of rodeos. There's rodeo was big in a community, baseball was big in another community. But anyway, just the look and feel of it. In fact, we just wrapped up a podcast with people from the Navajo Nation that are helping us understand better the specific needs of their area and their culture, and how they've used some of the underage drinking prevention media stuff to drill down. Now, using that same logic of a media campaign to capture the attention of people, I hope that you've heard me say that you get licensed, you can use it for free, great savings right there. Use whatever resources you might have to help to then go to the next step of mobilization, and let us help you develop those products. But there's also other things that are going on within Talk They Hear You. Say that a parent does get the message, I need to talk to my child, and they start talking and they all of a sudden realize, I want to know more about it. There's a a mobile app that, first of all, parents can use to help coach them through that piece. But then there's also a screening tool that's available that they can use to ask their kids some questions. And depending on how they answer those questions, the system's designed to then give them a referral to the resources that best match their needs. We call that Screen for Success, and you'll find that on that website as well. We're also working and nearly completed some brief interventions that would be available using some of the evidence-based programs or treatment programs and taking pieces of that will help, like motivational interviewing is an example. There's some quick lessons that can be learned from that model that parents could deploy in conversations with their kids so that they're not lecturing, they're not telling them what to do, but going through this process of open communication to find out more. In addition to that, there's a professional edition or a professional screener. It's the same Screen for Success, but schools or organizations could sign up for that to where they could better track or have the ability to track multiple sites that are within their area that might be wanting to use that screening tool for follow-up care and maybe even looking back to see how successful they've been to making these referrals. That's a really brief interview of Talk to Hear You. I'm going to show you a couple other slides of Talk to Hear You in a moment, but wanted to let you know that there's other tools that are available from SAMSHA. I know that's a lot on there, and so definitely we'll make this list available to you. I tried really hard to not include Pttc resources in there, but I'm just going to say this. My first stop when I'm looking for things like this is Pttc website. It's amazing. In fact, we're doing trainings with my entire staff on things that are tying in with the Pttc stuff. So you're on the right path with that. I wanted to share this really quickly with you with that statewide campaign that we did in Utah. We also did focus groups along the way to help drive those. This was the latest one that was done last year, and you can see how that can help drive a campaign. If you're going to develop a campaign or if you're going to be messaging throughout your community, these were the latest things that we learned from this focus group as an online community. 30 parents that or adults that said they were parents had answered these questions. And you'll see that it falls right in line with prevention principles. Scare tactics, those kinds of things don't work and can sometimes cause more harm. But what we've learned and what the parents are telling us is that family bonding, a positive message to what you're doing, and these other bullets that I have here are what we learned from that. Another resource, and this one I'm super excited about because I've seen where the DEA and law enforcement in general a lot of them have taken a real step closer to prevention science. But if you take a look at this website, and I'm not going to mess, I was going to show you some of the things on there. But this one out of Baltimore, the high intensity drug trafficking area, their office is in the Baltimore area. They put together this prevention intervention resource center, and they've got some fantastic resources for media campaigns in the prevention world, including social norms, how you go about doing that kind of a campaign, any kind of communications, words to use, words not to use, etc. I think you'll find that super useful and helpful. Now, let me just show you a couple things with going back to Talk to Hear You. Social media being a big resource to be able to use now. Once somebody registers with Talk to Hear You, they can receive monthly ideas like this. So we'll develop social media messages that they can take and then either just copy and paste them into their own, or make adjustments as they need to make to better fit what they're doing. The other thing is this, whatever that thing is, QR code here. If you can't find the catalog on that website that I pasted in the chat, you can use that QR code to get directly to the campaign products. But this just gives you an idea, again, of the print PSAs that we have that are available. And like I said, those pictures can be adjusted, the messages can be adjusted. We really want local folks to be able to make that specific to their area. There's a screenshot of the mobile app that I've mentioned. You can get that on any of the Play stores or where you download your apps. You'll see that the connections between, you get a parent's attention, they want just a little bit more. Okay, then there's a screening tool. Oh, they need a little bit more. Now we've got these brief interventions. Oh, hey, now there's this community event going on. We used to call them town hall meetings. There's resources for those through the federal government for coalitions to apply for. There's other grants that will do that as well. But the point being is that we have these toolkits available. If anybody wants to do a community event, they can do that. And again, that's a whole piece of mobilizing these efforts, throughout the community. There's my email and my cell phone. Happy to do, we've got PowerPoints that we can share with you. If somebody wants a PowerPoint and wants us to walk through it, we could do everything like this, 15-minute presentation or a 4-hour presentation, whatever's most helpful for you guys. So Joe, with that,